So Prinesh, what does impact mean for the healthcare industry?
So Julie, for us, impact measurement in the healthcare industry really refers to the process of quantifying, analysing all the effects of healthcare interventions, products, policies and projects within the environment, economy and society as a whole. It really provides critical information for decision makers and important stakeholders within the space, really helping them maximise value, increase access as well as increase equity of healthcare within the environment, and thereby making informed decisions within the healthcare space. Really what I think is critical around impact within the healthcare sector is that it's quite nuanced, right? And we see that there's three specific subsectors within the space that deserve their own attention. The first one is the healthcare delivery services or providers within the space, and private hospitals are a good example here. An example of some of the impact measurements that they're currently involved with is items such as paid patient days of occupancy. The second group is your product manufacturers or distributors, and probably the best example in this space is the pharmaceutical industry. And one of the key impact measures that they're currently reporting on and involved with is the access and availability of essential medicines. The last subsector within healthcare is the health insurer and financing institutions or organizations. And an example of something that they're currently measuring in terms of impact is the coverage across different socioeconomic groups within their financing products.
Right, so it sounds like the measurement of those impacts is really, really important and crucial. And so why is it that it's so important for the industry to actually measure their impact?
So at the moment, the reason that impact's becoming such an important question is behind the shift or transition that we're seeing in the approach to healthcare. So traditionally there was a model of sick care, and we're seeing a shift towards a model of personalised, proactive, predictive healthcare. Really, what we're seeing is that people were using healthcare facilities regardless of their healthcare status, and we're shifting towards a model of really making sure that people actually don't utilise facilities and reducing the burden and need on currently really critical resources within the healthcare space that aren't able to keep up with the current demand. So there definitely needs to be a shift towards a more preventative model of care. Secondly, what's also happening is that there needs to be consideration for the individual as a whole within this environment. And illness is really treated in isolation without any consideration for the context and social impact of that person upon their illness. And stakeholders are really starting to consider the social determinants of health critically within this space. So that's both the medical and non-medical factors that impact an individual's health outcomes. And lastly, why it's becoming important is that we're seeing from an investment perspective, impact investing is really forefront and top of mind for people within this space. Healthcare companies need to show good beyond just their products and services. There needs to be a holistic improvement in the systems and the consequences of their products and services within the industry.
And I think that's really where impact becomes such an important aspect, because what we're really looking at is the consequences, right? The consequences of these sort of activities and these initiatives. And so how is impact currently being measured in the industry?
So at the moment, what we've seen is that impact in the healthcare industry traditionally has rather been output rather than outcome measures. And this is because there's some difficulty in which the way in which outcome measures are currently reported within healthcare. Some of the challenges that occur within this is that healthcare is quite nuanced, and each of the subsectors is fairly nuanced within this space. The truth about healthcare is that there isn't, for most subsectors, a direct relation between what you do and the outcome of health metrics for an individual or a patient on a single level. Really, the entire involvement of multiple subsectors is involved in that outcome. So, each subsector really is nuanced in what it does, but also outcomes are really dependent on multiple factors and multiple stakeholders across that chain. And there's probably been a fear for single organizations within a specific area or subsector to try and report on impact within that space. Secondly, we know that, really within the healthcare industry as a whole, there's challenges around data, right? Really having high quality, accurate data to be able to report on outcomes specifically has been quite difficult. And then lastly, probably the biggest challenge within this space is standardization. There's no real regulatory driven standardization around outcomes. It's very difficult, for example, to measure quality across different service providers within the private healthcare sector as an example. So really, practically what it means is that as we strive towards more regulation and better regulation and reporting, quality outcomes, as an example, will start to be reported on. And really practically the way forward to really report on outcomes holistically is to have collaboration, right? We've seen it as an example looking at pharmaceutical manufacturers in the vaccine space. They need to partner with the companies that are actually delivering and ensuring that vaccinations occur within countries, because that's the only way they'll get access to the outcome data. So, really collaboration is key to ensure that health outcome measures across all the subsectors are actually reported on.
Yeah, and I guess that also then drives transparency and accountability as well.